for joining us this evening. We appreciate you taking the time out of your busy schedules. My name is Cindy Penkellen. I'm the Senior Director of the Physician Services team here at the AOA. And our webinar this evening is called Pivoting Your Practice Forward in 2020, Addressing Your Questions and Key Concerns. And before we move on, I'm just going to do a few little housekeeping. You all currently are muted, and to ask a question, please type it into the Q&A box found on your screen. And our lovely panel will do their best to answer the question, either throughout the presentation or following the presentation, should time allow. If it turns out that your question does not get answered, we certainly will do our best to get an answer to you. If you are having technical difficulties or something, please type that into the chat box, and I will do what I can to address that issue. Slides and a recording of the presentation will be available on the AOA website. And those of you that are watching this and hoping to obtain CME, you will need to go back to take the post-evaluation following the presentation, and that'll be available on the AOA online learning platform within the actual course. Disclaimer is basically stating that number one, this is should not be considered legal advice. This is for educational purposes. And that the information provided is being done to educate you and to help you, and that the information presented was current at the time the presentation was put together, which was done today. We are very fortunate to have with us a great panel from the McDonald Hopkins law firm. Isabel Kaliniak, if I didn't butcher that, Isabel, I apologize. She is going to tell you a little bit about herself and about her fellow panel members, and I will turn it over to them to get started on tonight's presentation. Isabel?
Thank you so much, Cynthia, for this warm introduction. My name is Isabel Kaliniak, and you can pronounce it any way you want. I am a partner in the national law firm of McDonald Hopkins, and my specialty is healthcare. I represent a broad variety of physicians and physician entities, as well as hospitals across multiple specialties. When we put together this panel, we had in mind what can help you and how can help you pivot your practice in 2020 after this pandemic, and how do we move forward. And we just want to address your questions and key concerns. We've started to gather questions through the website. We'll keep taking them throughout this program. But without any further ado, let me introduce you to my colleagues. Ryan Neumeyer is our labor and employment specialist this evening, and that is definitely an area where you should be focusing during this COVID-19 and post-COVID-19. Then we will go to Mr. Jeff Van Winkle, who's in our Chicago office, who will cover some information about all the types of government programs, such as the SBA loans, the EIDL, etc. And then Mr. Adam Grace, our tax specialist, will tell you all about the PPP loan forgiveness, and will be also available to answer any tax-related questions to that. So I'll leave this to Ryan, and please continue to send your questions through the website, and we look forward to speaking with you. Ryan, all yours.
Unmute. Thanks, Isabel. I really appreciate the AOA for having us tonight, and I hope you can take something from this and use it in your practice, or it answers some questions that you may have. If you could skip to the next slide, actually skip to slide 5. We do have a shortened period of time this evening and a lot of information to get through, so we're going to try to get through that as quickly as possible. This first slide really kind of, in a very basic way, shows employers on what do we need to do in this COVID reopening time period? And if you haven't already done it, not all employers have, but you want to look at the CDC guidance, the OSHA guidance, and then your state and local orders, your Department of Health orders, and use that information to develop the operating protocols for the physical workplace. And what do you need to do that? You need to assess your workplace, okay? So you're analyzing the workplace, you're determining what steps and procedures that your specific workplace is going to need. I have seen that some associations as well have put out form documents, law firms. There's a lot out there online that you can get. The thing about that is it's not one size fits all. There's some basic procedures that you'll find in your CDC guidance, your OSHA guidance, and your state and local orders. But you really want to look at your workplace and make sure that you're developing, protocols for safety and health checks, your building reception. If you do get packages, how are you going to deal with that? Visitor policies, you're dealing with patients as well. So, we want to make sure that we have a good ingress and egress system set up. You're going to want to make sure we're communicating with those folks too prior to coming in as to how it's going to work. We want to prepare the building. So wherever you are, you want to prepare the building, have a cleaning plan, make sure you're doing inspections. Some things that some folks haven't thought about, but HVAC and mechanicals. Also, preparedness and controls, reviewing and following the guidance to the extent that it's appropriate. Again, anticipating issues that may arise in the workplace and developing strategies to address those issues, such as grouping at the door and things like that. Different issues with touch points, making sure that we're keeping them as clean as we possibly can. Who has access to the workplace? And here's something as well that a lot of folks haven't thought of prior to is, when we have a multi-tenant building, you're going to want to coordinate with the landlords and the other tenants as to what you're doing to maintain as safe as possible environment that you can following these guidelines. So that's something. And you might have to reconfigure your workspaces, especially in a medical practice, the front. You've got a lot of rolling chairs and people bumping into each other. You're going to want to think about that to determine whether there's ways to prevent that from happening and occurring. So also plans for staffing. Again, can we stagger the staff? Some people are furloughing, those types of things. We want to make sure, again, that we make the workplace as safe as we possibly can. Another areas are, have signs up about sneezing. Where do you put your nose? I know it sounds silly, or keeping that social distancing, just reminders to wash your hands. You're going to want to put out, the hand sanitizer and all those good things. So these are all kind of just ways in which we can make things a little bit safer. So developing operating protocols for employees. Hopefully we have training in place, because we may have we can have all these policies, but if we don't tell our employees what we're doing and what they need to do, then they're not really worth all that much, and they're not making us safer. Health screenings, that's taking of the temperature, those types of things. You're in a little bit better place than most employers, being physicians. I always do, when I do counsel physicians, though, I also tell them, don't diagnose your employees. Physicians are always trying to figure out, what's wrong with their employees and fix them. And with employment law, we're documenting, and we do tell folks how to fix their issues, but we're not, especially in the ADA context or disability context, we're not diagnosing them and actually fixing their disability. We're just telling them what they need to do at work. Best practices, those best practices, again, can be found in a lot of the state orders, your OSHA guidance and your CDC guidance. So there's certain things, you know, the social distancing where you can, telework where you can, different things that are kind of, you know, basic. But then there's certain things in different areas that can be above and beyond, and you'll find those in that guidance that we talked about. If you could go to the next slide, please. Okay, excuse me real quick. You have to excuse me. I'm on my phone, so I have to move down as well. Okay, so on my computer. So access to the workplace, here's some of the things for physical distancing measures. You know, and a lot of medical practices have been doing telehealth, so that's a big thing. And again, enable employees to work from home where possible. You know, that's not always possible in medical settings, of course. Restrict number of patients where you can, make sure your scheduling is good. Change arrival and processing procedures so that there's only one person or a few people in the waiting room. We don't want a lot of people sitting in the waiting room. Social distancing measures, limiting close contact, conduct meetings virtually. You know, we don't want to have big office meetings where everybody's present, all hands on deck. You could do a Zoom meeting for that. Limit attendance and time at meetings, use outdoor spaces, use masks in closed settings, use floor markings, shield barriers where appropriate. Maybe in the waiting room, you might want to put up some plexiglass. And that way it might be a little bit more amenable to having more folks in there. You know, you're going to want to get rid of all your magazines, guys and ladies. Of course, in the waiting room, we shouldn't be seeing any of those anymore. You know, so I guess you can save a few bucks on the magazine subscriptions. Social distancing measures for limiting gatherings, implement social distancing at meetings again, cancel unnecessary meetings, convert to social or virtual format. And one big thing is pre-meeting seating assignments. And if you are going to have in-person meetings, make sure you somehow inform folks where they're going to be sitting so that you don't have people kind of figuring that out. And again, providing barriers. So if we can go to the next slide, that would be great. So here's OSHA standards. A workplace that is free from recognized hazards that are causing or likely to cause harm or injury. That's the general standard. So develop and implement a sanitation plan, increase cleaning schedules, identify who will be responsible for the cleaning schedules. And a lot of times nowadays, I'm advising employers to actually, you know, use non-cleaning staff to make sure that different touch points are clean. And that could just be taking a spray bottle and wiping down a point of contact. But sometimes, you know, you might have somebody, you know, and hopefully folks are a little bit humble, and some people, you know, you might not be able to get to do that. They'll say, that's not my job. But for the most part, employees have been very willing to help. So that's something that's a little bit new. Ensure that those in charge of cleaning are provided with appropriate personal protective equipment. So if it's a sensitive area where they need to have some sort of additional mask or maybe an N95 or something like that, you know, you're able to provide that equipment. Provide ample time for cleaning and disinfecting facilities and actually our offices. Ensure quality insurance checks. So make sure after we are cleaning that somebody's checking to make sure that it was done and done properly. So the process, train employees on infection prevention and control procedures. And again, that's going to the CDC, looking at their processes and training the employees on those processes. Create or modify training modules to include implemented public health and social measures. It could be a video, you know, a short video, short signage, a PowerPoint. We've been doing those for our clients. So giving a short PowerPoint. Actually, at our law firm, I think we have one that we did. Display signage. Again, we talked about that again. Identify means to distribute information on the best practices in the workplace. So again, that's just making sure that we're getting the information out to all of our folks, all of our employees, so that they know how to properly maintain a clean and healthy workplace. The practices provide means by which employees can sanitize objects. So again, if you have a copy machine, you should have some sort of spray bottle there, hand sanitizer, things like that. Provide as much as you can self-service cleaning wipes and sanitizer, hand sanitizer, dedicated cleaner for handles, trolleys, baskets. Those are things to think about. Provide protective coverings for high-touch surfaces such as
I believe we've lost our speaker.
Okay, you can't hear me? Hello? Hello?
I can hear Ryan.
We can hear you, Ryan.
Yes.
Okay, great. So finally, and I'm going to move through this somewhat quickly, provide equipment to limit direct access to high-touch surfaces, gloves, single-use tools. If we could go to the next slide. I don't know if I'll just kind of read this. So OSHA reporting guidance, and I'm not sure that the person who's in control of the slides can hear me, but the next slide has to do with OSHA guidance. Yeah, and she can't hear, so I'm gonna text, oh, here we go. Okay, so the new OSHA guidance puts the burden on employers to determine if COVID-19 cases are work-related, and this is huge for the healthcare field. So if you're required to fill out an OSHA 300 log, many of you may not. You may be under the 10 employees, but if you're over and you're in the industry and you have to report, you do potentially have to report COVID-19 cases. There are 3 criteria. It's a confirmed COVID-19 case. There's work-relatedness, meaning that the COVID-19, maybe you had a COVID-19 positive patient and then a nurse got infected. That would prove work-relatedness. Illness resulting in death, days away from work, restricted work, or transferred to another job, medical treatment beyond first aid, or loss of consciousness. So if you do get an infected employee, they are going to meet these 3 requirements. So if you have to, more likely than not, if it is work-related. If it's not work-related, so you find out that the individual went to a picnic and 20 of those people at the picnic got COVID-19, then I think you would make the assumption that it wasn't work-related. But the OSHA guidance here, and remember, not all states have federal OSHA, so there is state guidance as well. Typically, they're going to follow lockstep with this, meaning that the state OSHA, such as I believe Michigan is state OSHA, Kentucky is state OSHA. There's other states as well, quite a few, because it's a little bit of a money maker for them, actually. But they might have a little bit different rule. But so far, what I've been seeing is that the state-run OSHAs have the same. So employers must make reasonable efforts to determine the exposure is not work-related, asking the employee limited questions about how the COVID-19 was contracted, make inquiries about the employee's work and non-work activities and possible exposure, investigating the employee's work environment to determine if COVID-19 exposure was possible. So those are things you can do to determine whether or not it's work-related. Can we go to the next slide, please? Okay. Looks like I think we skipped one, but that's okay. Actually, we skipped a few. Can we go to slide 9? There it is. Okay, real quick. And this is developing response scenarios. So since we're a little bit short on time, I'm just going to tell you the basics here is, we want to know what are we going to do ahead of time if somebody has COVID-19, somebody may have come in contact with somebody that has COVID-19, or somebody has symptoms. And, obviously if someone has COVID-19 and they tell you and you tell them not to come to work, to call in, they should know that ahead of time, that if they have symptoms, they're not to come into work. and then they're going to go get checked out by their doctor. And if they have a positive, then you're going to come back and skip trace, see who that individual was around at work. And if somebody was close to them, if they're symptomatic, of course, you'd send them home, or if they're asymptomatic, the guidance now is saying to send them home, self-quarantine for 14 days, or get a negative test to come back to work. But you'd want to have these steps down in a policy. And I've been having employers actually sign the policies. Our employees sign an actual policy, which includes this information. Next slide, please. So the next slide is the FFCRA, and that's the Families First Corona Relief Act, and FMLA Administration upon return to work. So if your FMLA is over 50 employees, these EPSL is paid sick leave, and that provides 80 hours of emergency paid sick leave for coronavirus-related incidences. They're not available for healthcare workers. So if you have folks that are in the file room, potentially, there's a question. You should talk to your attorney. I've dealt with the DOL in a few of these cases for retaliation, but typically this is not going to be applicable to a healthcare provider. If certainly an employee such as a nurse and others, but it could potentially be it could potentially come into play when you're dealing with your administrative staff. So that's something to be cognizant of. But the EPSL, the emergency paid sick leave, is for time off due to COVID-related reasons, either for your own or to care for others. The emergency FMLA provides up to 12, and it's also for the first 2 weeks of childcare, and then you get up to 10 weeks. The first 12 weeks of leave for childcare, the first 2 are unpaid; they're paid by the paid sick leave. The next 10, and it's paid at 2/3 of the individual's pay, up to $200 a day. So that's the emergency paid sick or FMLA. Then we have the classic FMLA, which is 12 weeks of leave for a serious health condition. Employees who have coronavirus or are caring for a family member would be eligible for this. Remember, this is 50 or more employees, so it didn't lower that standard. The FFCRA didn't lower that standard to make everybody eligible for FMLA. And just so you know, the EPSL and the EFMLA only applies to employers that are under 500. So if you're under 500, then it applies. The FMLA, though, is over 50 employees. And, you know, just to give you a flavor of what that is about, but for the most part, you're probably not going to be affected by that. Can I go to the next slide, please? Okay. So real quick, ADA considerations, and I think I'm going to be going. I think I've got 1 more minute, but just suffice to say that you need to be cognizant when you're dealing with employees and that have COVID-19. The EEOC and many state agencies have said if you have a prolonged illness, that could be a disability under the ADA, and therefore that individual may be eligible for an accommodation. Just talk to your employees, see what they need. If they do have COVID, obviously they're going to need leave. And then also one important point is confidentiality. So the ADA, the ADA actually provides for confidentiality for employers. So, you know, as HIPAA provides confidentiality for our patients, the ADA says we need to keep our employees' medical information confidential. So if Sally or Bob get COVID-19, we can't tell George and Elaine that I'm Seinfeld there, but we can't tell George and Elaine that Bob and Sally got COVID-19, even if they might even know who got COVID-19 and who had been working with them. We would just say, there are employees who did test positive, and they would say, well, is it George and Elaine? And we would say, we can't say that legally, so we're not going to comment on who it is. We'll just say that they worked with you. So just that note. If we can go to 12, please, the next slide. Okay, so 12 is employers should consider the working relationship has been impacted and what promises and expectations have been communicated. We have reduced schedule. So if somebody has a reduced schedule, the employee may be continuing to work. A reduced schedule may or may not have been remote. Expectation is that you work the hours and then later return to previous level. So these are different ways in which employers have been kind of dealing with the downturn caused by COVID-19. Question I always get is, what's the difference between a furlough and a layoff? And it's really a term of art. A furlough is generally understood to be a temporary reduction in hours of work due to economic or operating conditions. Expectation that the employee will return to work and you keep paying their benefits. A layoff may be like a furlough, and that is a temporary cessation of work or maybe a permanent break in employment. You could lay someone off permanently. Typically, it means a temporary layoff, and then a RIF, reduction in force, would tend to connote a permanent term job separation. So just to give you an idea of what the differences are in relation to that, and then there's different issues that pop up when you're doing a furlough, a layoff, or a RIF, or just a reduced schedule. But those are different avenues that you can take to kind of reduce cost in relation to downturns from COVID. If we can go to the next slide. All right. So the employee is afraid to return. This is a question I get a lot of. What do I do if somebody doesn't want to come back to work? And presently I'm saying, let's not terminate this individual. Really it's communicate your work expectations. And I'm going down to that second bullet down there, because this is really kind of what we tell employers, assuming that, there's no telework available. Possibly, I think you do want to still give them unpaid leave and not terminate them at this point. But you potentially could. I would talk to counsel about that. But you want to communicate your return to work expectations. The way I deal with that is I'm going to give you a letter basically stating all of the things that we're doing to keep our workplace sanitized and as healthy as we possibly can. And then I'm also going to tell you, what our expectations are for your return to work. And then I want to indicate to that individual that they're not going to be eligible for unemployment, and there's no PTO if there isn't. I mean, they could use their PTO, I suppose, and you could let them if you'd like. That would be according to your PTO plan. And there's no governmental benefits that would pay for this time off simply because you're scared of getting COVID-19. And that can change if the person actually has asthma or some pulmonary disease, something that makes them more at risk to dying from COVID-19, and they would have to kind of come forth with some sort of medical information that would advise you of those different conditions to maybe provide them with some paid leave. Can we go to the next slide, please? So 14 is we're dealing with the unemployment benefits. Businesses that reopen may not be able to bring back all the workers, or may have to bring back workers at reduced schedules. Some employees may not be able to return to work. Many states, and I'm in Ohio, so including Ohio, have expanded unemployment benefits to cover COVID-19 work-related losses. So in most states now, anytime you're not working because of COVID-19, you're going to be able to get unemployment. I'm not aware of any states that have not made that amendment to their unemployment. Big thing here is the $600 that's in play until the end of July. Makes things makes things very difficult to bring folks back to work. Consideration in handling the return to work disincentive. Try doing a partial return to work with a partial unemployment benefit. They'll still get the $600. Work share program option. So work share, if you get a check, each state is a little bit different, and not every state has work share, but essentially it's where you have a certain percentage of employees in a group working part-time. They receive a benefit from unemployment. They would also receive the $600, and they'd be working from you and getting paid. So that's a solution. And just making sure that you establish return to work expectations and report that work is available to the unemployment benefits agency in your state. So when somebody applies for unemployment benefits, you're able to kind of let them know, like, look, this person has a job available, and hopefully the unemployment agency won't grant them unemployment. But I've been seeing that the unemployment agencies in most states are, liberally granting unemployment, regardless of whether the employer tells them that there is work available. So if anybody has any questions, I'm going to be checking the chat on the Zoom call, and I can follow back up in relation to employment issues. But with that, I'm going to go over to Jeff Van Winkle, and he's going to talk a little bit about some of these great SBA programs that are available to help us out with some of the financial burdens from COVID-19.
Thank you, Ryan.
This is Jeff. Can you hear me?
Yes.
Okay, great. Screen said I was unmuted now. So great information, Ryan. And I want to just, if you can turn to the first slide of my materials, which are businesses adapt. Next. Perfect. Great. So just a quick, my hunch is most of you participating tonight have been thinking for some time about what it's like to reopen, and you've been living through, either as a participant in a practice or as a practice leader, a lot of things about what does it mean. Ryan touched on a lot of the practical and employment related issues. Those are all important, but I want to just remind you of some of the things that also are impacting. Practices closed or substantially closed during the pandemic. And it's probably not telling you anything new that the restart or rebuild process is more difficult than closing. No one really thought about that. You canceled appointments, you terminated future procedures, and people went home. And then they started to realize what was going on. Restart is hard. It's governed by some state guidelines and issues. Ryan covered a whole bunch of things it's governed by. Physicians and other employees may no longer be able to, or willing to work, or able to work in the same manner. There's some direction to work from home, and cash flow is different. The regular flow of cash in on a monthly basis and expenses being paid was interrupted, and many businesses are dealing with how do we come up with the funds necessary to restart, because we utilize the funds that we would ordinarily have. That break in the flow has made it very difficult. And as a corporate lawyer, I've been helping businesses sort through how to respond to some of those things. Some of it is using the government assist money, and we'll talk about that a little bit, about how that will impact, how those are opportunities. Sometimes you have to look at all other alternatives and think about the practice or the organization itself. And so if we could turn to the next slide, I want to just talk, these are just some examples of the things that we are covering, and we encourage you to be thinking about in your practices, whatever your angle is on that, as you go through this restart process, as you pivot your practice, as the title says. So one, review the organization documents. You know, no one that lawyers are really in love with their documents, but it turns out you should confirm that anyone who should have signed a document has actually signed. It's a good time to check, because you may need to figure out how they apply. If someone has to leave, and then you need to admit someone else to a practice. It's also a good time to make sure that all of this, I listed state registration for the organization, that you're up to date in terms of the business registrations. That is an important piece because in the day-to-day hustle, it's sometimes omitted, and it's an important thing to have up to date. And then as some changes may happen, if not now, maybe later this year, one of the things that we encourage folks in healthcare organizations, particularly private practices, is to take a look at what is the buying in and the buying and the selling pricing structure. Does it still work for your organization? Have there been changes? So this is a longer term thing to deal with, but you need to be thinking about it. Just another thing on the, turning to the other side of the slide, you need to be communicating with third parties. Some of this goes hand in hand with the practical realities covered in the first part of this program. You're coordinating deliveries and processes with vendors, and it may mean changing some agreements. A process, a supply chain, dare I say that, for getting the right sanitizing materials in. And that has been easy for some organizations and harder for others. And then the third thing that we recommend that you think about is making sure you're communicating, not with just employees, but with third parties that are relevant outside of your organization. It may be could be a group of vendors. It could be the way that you communicate with your patient community. It could be with other organizations that you work with on a partnering basis. But more communication is better than no communication. And lack of communication creates uncertainty. So those are just some thoughts that I encourage you to think about. If we could turn to the next slide, and we'll take a quick look at the current landscape for really 3 SBA loan programs. And this conversation is a summary of what's current now. People have been following the news for months now, actually, and the updates and the changes through the SBA and Treasury programs has been mind-boggling. And it's particularly relevant today in that world of forgiveness of the PPP loans, which Adam is going to talk about later. I'm going to set the stage and just remind you what's available today, still available, in case that's relevant for your practice as you think about reopening. First is the EIDL. You can see the abbreviation on the screen. And the news today, which was a little unexpected, was that last week the SBA announced that the portal to submit applications had reopened so that people can resubmit. It had been closed for a number of weeks for everyone except agricultural businesses. These loans, let me just identify, so eligibility, it's small businesses, and it's the kind of standard SBA eligibility requirements. It's a little bit expanded because it does include what we call private nonprofits, and some healthcare organizations fall into that category. But it is not far beyond kind of the normal category of SBA borrowers. The EIDL terms are pretty straightforward. You do it and you enter it on the portal. You're going directly into the SBA portal. So you kind of have to do it yourself or get a business manager from the practice to be doing if you're doing one of these. The loan amount is determined by the SBA after you submit the information. I know it seems weird, and those of you who've gone through it have figured that out. For a while, it was a maximum loan of about a very modest amount. They're now doing some larger ones. Anyway, it's a set interest rate, as it states, maximum loan term, and you don't have to show that you can't get credit. But there may be, for the larger loans, both personal guarantees required, and there could be collateral required. You get an email with the information from the SBA, and then you process it through. If it's going well, it moves smoothly, and you can get your hands on the money in your bank account relatively quickly. So that's the EIDL. If we could flip to the next slide, I'm going to just briefly cover the PPP loan. Yep. So there's more than $100 billion left. That's a lot of money. There's a lot of focus on smaller organizations right now. It could be helpful for your practice or your organization. I don't know. Just a reminder, loan amount is 2.5 times the average payroll cost in a given month, basically for 2019. And please, these are very quick summary notes. You need to check with detailed resource providers. We can do that. Others do that as well. There's lots of resources, but this reminds you of what's out there. Interest rate is very low, 1%, no fees, no guarantees, no collateral. And we've identified on the slide what the payroll costs are, and you'll get these materials, and so you can review that. But that sets the loan amount. And so the loan amount is this 2.5 times the average payroll cost. Adam's going to be talking about the forgiveness process, and there have been lots of changes there. But this sets the amount of the loan. Now, there is some interesting interplay. Just people talk about how do the EIDL and the PPP fit together. So there was some confusing and incorrect information out there before. But it is pretty straightforward right now. And so there are some instances when you would have to use your PPP loan to refinance the EIDL. And some when you would not do that. But the current status and the best way to think about it is if you get your EIDL loan now and it's new to you, you will not be refinancing it with a PPP loan. You can have both of them. They're used for different purposes, but you can have both of them and you can't refinance them. So think about that. They both stand out there. There's a few other rules on that, but I think you need to just understand that. Then let me quickly touch on the last loan that is of current interest. If we turn to the next slide, and this is the Main Street Loan Program. This is actually by the Federal Reserve. It's under the CARES Act. It's not the SBA. It took them forever to get this thing going, but the basic parameters are businesses can get loans of not smaller than $250,000, and they can go up to very large. So it's intended to hit middle market and even larger businesses. It has a more interest rate that's higher, and you're going to have to pay some fees and provide some certifications about how you're going to make distributions in the future. So it's much more restrictive. This is a loan that you get if you really need cash flow to help you through for the next couple of years. It's a program that could provide availability if you don't have it currently, but it is not going to be for the immediate desperate need for cash flow. It really fits a different niche than the PPP or the EIDL. All of these three different programs coexist at the same time. So that is a quick overview, and I'm going to kind of turn it to Adam. He's talking about forgiveness, and forgiveness applies to only one of those three loans. And the answer is it's the PPP loans. The EIDL must be paid back, and so is the Main Street. But if you follow the right hoops and right instructions, you can have your, you may be able to get forgiveness on your PPP loan. So with that, Adam, I'm going to turn it over to you, and you can take us on to the finish.
Great, thanks, Jeff. That was a good overview of the programs that are out there. And I am going to focus on PPP. One thing just to add to what Jeff said, if you are still thinking about getting a PPP loan and you don't have one yet, part of that $100 billion that is still left to be loaned, you've only got a week to do it. The loan cutoff date is June 30th if you haven't applied for a PPP loan yet. So if we can jump to the next slide. So we've been talking about the loan forgiveness process, and actually a lot of the PPP has been described as building an airplane while you're flying it. The PPP program is complicated, and it is an integration of some SBA lending programs and some tax rules. And tax laws are complicated, and they usually get developed over months, sometimes even over years. Well, the PPP was enacted as part of the CARES Act 3 months ago. And Congress wanted to get billions of dollars out the door quickly. So we've been kind of making it up as we go along. So in the 3 months since this was passed, we've had 2 pieces of legislation, the CARES Act and the Paycheck Protection Program Flexibility Act. The IRS has issued 48 FAQs about how this works, and supposedly there are 30 more coming. And when I finalized my slides last night, we had 19 releases of interim final rules and amendments. And then I woke up this morning and there was another one. So now we have 20. And then there were 2 different forms of loan forgiveness applications out there, one of which has already been revised. The SBA, for some reason, seems to like to drop these new guidance in the middle of the night, frequently at 11 o'clock on Friday nights, perhaps because they want to ruin my weekend. But the important thing to remember is circumstances continue to change and the guidance continues to change. And every time the guidance changes, you need to rethink what's the best approach to getting the maximum amount of forgiveness possible for yourself and for your business. And the other thing to keep in mind is loan forgiveness can be driven by a lot of mathematical formulas and a lot of things that they're trying to get you to do with different incentives, but you need to also keep in mind what's important for your business and what's important for your patients when thinking about how to spend this money. If we can go to the next slide. So what is PPP loan forgiveness? Well, this was one of the questions that we were asked, relates to this. But the first thing is you don't have to pay back your PPP loan if it's spent on certain things, covered expenses, during a certain period of time, the covered period, and I'll talk about both of those later. Now, typically when you have a loan that is forgiven under the tax law, you have to pay tax on the amount that's forgiven. So technically, under the CARES Act, Congress changed that and said the amounts that are forgiven under the PPP program are not taxable income. Everybody thought that was great news. Then a couple weeks later, the IRS came out with a ruling that said, well, actually, because that amount is not forgiven, when you spend the money on expenses that would otherwise be deductible with your PPP loan, those funds, those amounts are no longer deductible. In other words, it's a wash. So the PPP forgiveness is not forgivable, but you're losing your deductions. The other question I've gotten sometimes is what happens if I don't use up all the money? Well, as Jeff's described, these are actually loans. So to the extent that you have an amount that's not forgiven, that amount's going to be a loan. Now, initially, under the old, before the Paycheck Protection Flexibility Act was passed, the loan term was set by the SBA and the Treasury at 2 years. Congress didn't like that. They wanted to give people more time. So loans going forward are 5-year loans. And if you had got a loan before the Paycheck Protection Flexibility Act was passed, you can go back to your lender, but you have to negotiate to get that longer term. Let's go to the next slide. So one of the important things we've been talking to our clients about is that it's important to work with a professional who understands this. As I said at the top, tax laws are really complicated. And unless you're a sole proprietor with no employees, as you'll see in a minute, this stuff gets really complicated really fast. And the rules are frequently ambiguous, constantly changing, and they don't necessarily make a whole lot of intuitive sense. So it's important to be working with somebody who understands how they work and has some perspective. Now, nobody was doing paycheck protection loan forgiveness 3 months ago, so we've all had to kind of learn on the fly. But as we're dealing with a lot of different clients and seeing a lot of different issues, we're learning things and understanding areas where there are nuance and things we have to figure out. The other reason it's important to work with a professional is because part of the process is after you've submitted your loan application, your bank's going to look at it and the SBA is going to look at it. And it's possible that your loan forgiveness request and even your original loan application could then get reviewed. So you want to be sure you've got consistency in the preparation and the presentation, and if it happens, the audit of your application so that you can protect yourself. There are some certifications that have to be given, some of which are a little vague. And as a result, you want to make sure you've thought about those certifications before signing the applications. And we'll talk about the differences between borrowers who have more than $2 million and borrowers who are under that threshold. Let's go to the next slide. Okay, so as I said, one of the requirements for the PPP program to get forgiveness is you have to spend the money on covered expenses. And they're generally broken out into 2 buckets. The first is payroll costs. The basic and main idea of the PPP was to take the burden off state unemployment agencies and to get employers, to have employers continue to be paying their employees. So the principal component of the PPP covered expenses are payroll costs. Initially, the SBA had said you had to spend 75% of your loan on payroll costs. Congress came back and changed that and said, no, only 60%. So what's included in payroll costs? It's cash compensation, bonuses, wages, salary, that sort of thing. But there's a limit on that amount. It can only be on a prorated basis, $100,000, equal to $100,000 in salary. Then for employees, on top of that, you're allowed to include amounts that the employer has paid for health benefits and retirement benefits for the employees, and then also payroll taxes that the employer pays on that compensation. Now, there's some different rules when you've got employees who are also owners of the business, and I'll go into that a little bit later, but I expect that that's going to apply to a lot of the people on this call because doctors frequently own their own business. The other category of costs, the other 40%, if you want up to 40% that can be spent on, are other things to sort of keep your business running. Now, all of these things have to have been entered into by before February 15th of 2020. So, for example, mortgage interest. If you own the building in which you're operating your practice and you owned it before February 15th and had a mortgage put in place before February 15th, you can deduct the interest, not the principal, but the interest in your mortgage payments. They also say you can deduct interest on personal property. We don't usually talk about that as a mortgage, but really the idea is if you took out a loan and it's for some equipment and that loan is secured by that equipment, you can deduct the interest on that as well. Similarly, rent, if you don't own the building, but you're renting, you can deduct your rent. And same thing, if you're renting that equipment, you can deduct the payments for rent. The last category is utilities. Electric, gas, water. We're not quite sure exactly what transportation means, but we think, for example, reimbursing people for mileage is probably included. Phone charges and internet access. So as you're spending money on all of these things, you want to make sure you're keeping detailed records so that when you go to do your PPP loan forgiveness calculation, you can roll all of that in. Let's go to the next slide. So the second piece of this was your covered period. When do you have to spend the money? So the first thing we need to be concerned about is, well, what is included? So your forgiveness amount is the sum of all of those covered expenses that we talked about in the last slide, where the costs are incurred and the payments are made during the covered period. And what I quoted there was the language from the CARES Act, but what they really meant was either the costs were incurred, so somebody is being paid for working during this covered period, or the payments were made during the covered period. So even if you had an expense that was starting to accrue like rent before your covered period starts, if you pay it during your covered period, that's going to be an allowed expense as well. So the covered period starts on the day you get your loan. And originally under the CARES Act, that covered period was 8 weeks. Now, after the Paycheck Protection Flexibility Act, Congress said, you know what? Our experience has been that this 8 weeks isn't long enough. People aren't going back to work. Businesses are having trouble spending the money. So Congress has now given people the option to use 24 weeks going forward. If you had a loan in the original round of the program before the Paycheck Protection Flexibility Act, you can choose to use that 8-week period, although there are really limited circumstances where that's going to make sense. Generally, most people are going to want to take advantage of this 24-week period. They also, people were running into problems saying, hey, I got my loan in the middle of a payroll period. How is this supposed to work? This is really making the math hard for me to figure out. So the SBA said, well, we're going to let people solely for purposes of their payroll use what they call an alternative payroll covered period. So you start on the first payroll period start date after your loan has been made, advanced, and then you count 8 weeks or 24 weeks from that date, solely for purposes of counting your payroll. So the idea was to try to make it a little simpler for people by having this alternative payroll covered period. Let's go to the next slide. So as I mentioned, when we're looking at payroll and counting payroll for owners, the rules are a little different, and it gets really complicated here because it depends on how your business is taxed, whether it's an LLC or a partnership that's taxed as a pass-through. If you're taxed as an S corporation, or if you're taxed as a C corporation, or maybe you're just a sole proprietorship and you're self-employed, or you're a 1099 independent contractor and you've been able to take out a PPP loan, and so you're taxed on your self-employment income. So for self-employed individuals and partners, and that includes members of LLCs, it doesn't matter how much you are actually paid in the covered period. There is just a deemed amount based on what you were paid in 2019 that it's going to get included. And that amount is going to get capped, and this is down at the bottom, depending on which covered period you use, 8 weeks or 24 weeks. I mean, you can see the amounts and sort of the fractions down there. If your business is an S corporation or a C corporation, again, it depends. If it's a C corporation, then you're treated like any other employee. Your W-2 wages count up to a prorated amount of $100,000. And amounts paid for your health benefits and your retirement benefits are included. But if it's an S corporation, you get the retirement benefits, but not the health benefits. And this all gets back to the technicalities of the way things are taxed. But again, it's complicated, and it got even more complicated last night because the SBA issued some guidance that said, when we are looking at owners of a business, if you own multiple businesses, your compensation amount can only be counted for one of those businesses. Notwithstanding that when you put in your loan application, you were allowed to include your compensation as an owner for multiple businesses in the applications for those businesses. Now, when you're going for forgiveness, only one of them is going to get to include you for purposes of calculating the forgiveness amount. I have no idea how that's going to work. That seems to me to be very administratively difficult. I mean, potentially you're going to have to ask all of your partners, are you being included in somebody else's application? It just seems really unworkable, but that's what we have to deal with sometimes. And as I said, that guidance just came out last night. Let's go to the next slide. The other thing that gets complicated is that even though you could spend your funds in exactly the right way, your loan amount may get capped. So first of all, as I talked about before, you have to spend at least 60% of the money on payroll expenses. So if you haven't done that, then your loan, and you spent more on non-payroll expenses, the maximum amount of the loan is going to be determined by those payroll expenses. So basically what's going to happen is you're going to take the amount of the payroll expenses, you're going to divide it by 60%, and that's going to determine the maximum amount of the forgiveness. There are also two other ways in which your loan amount could get reduced. If you have reduced the salary or hourly wages of employees who had made less than $100,000 last year, and you reduced their salaries during your covered period, as compared to the first quarter of 2020, you're going to get a reduction if that amount was more than 25%. It was a greater than 25% reduction. Similarly, if you laid off employees, meaning that your number of full-time equivalent employees went down, that could result in a proportionate reduction in your forgiveness amount. And the crazy thing about it is you do that comparison not just against the first quarter of 2020, but also from February 15th to June 30th of 2019. So you've got two different periods that you're looking at when you're looking at different tests. Now, you may be able to eliminate either that salary reduction, actually both the salary reduction and the full-time equivalent employee reduction. If you eliminate those reductions either before the end of the year or before you submit your loan forgiveness application. And this is where we get into doing a lot of planning with clients who've had to make some of these cuts in terms of figuring out what's the best time to submit your application, You know, where should you be spending your money? And as Ryan mentioned, the problem is that Congress sort of cut the legs out from people who have low-wage employees by giving those low-wage employees the $600 in extra unemployment per week through the end of July. I've seen this with a lot of restaurants, but I expect you may be seeing this in your practices as well. You want to bring somebody back, but they won't come back because they're making more on unemployment. Now, the SBA has said if people won't come back for that reason, you're allowed to take them out of your calculation, but it gets a little bit complicated when you're doing that. Let's go to the next slide. Now, the SBA, as I mentioned before, has issued two types of loan applications. One is called the EZ form. Very few people, I think, are probably going to end up using it, but it's really for self-employed people with no employees or people who have had no wage reduction and no reduction in the number of full-time equivalent employees, but that's actually not as easy as it sounds. Or people who've had no wage reductions, but they've had to had reductions in their full-time employees because of certain government rules. The Paycheck Protection Flexibility Act said it was only these federal agencies, HHS, CDC, and OSHA, but SBA last night actually said this includes government shutdown orders. The reason I think that not a whole lot of people are going to use the EZ form, except in the simplest of cases, is you still have to run all of the same numbers that you have to run for the full form, and you have to be ready to possibly provide those numbers to your bank and to the SBA anyway. So I think a lot of people are going to end up filling out this full form, and the unfortunate thing about it is as part of those applications, you're going to need to provide detailed information about your staff. You're going to need to list every employee. You're going to need to list, you know, how much you've paid them. You're going to need to say what their full-time equivalent hours were. And if they were making less than $100,000, you're going to need to list, you know, what the amount of that reduction was. As I mentioned, even if you're an easy filer, you're going to have to run all these numbers. Now, the SBA has said, or actually the Paycheck Protection Flexibility Act says that the due date for your forgiveness application is 10 months after the end of your covered period. That's great. You have a lot of time to figure out all of this stuff. Although, as I said, you really should be planning as you're going along in terms of how you're going to spend your money. If you want to shorten that, the SBA said actually last night, you can submit your application at any time. So even if you're using the 24-week covered period, you could submit your application after 12 weeks if you've spent all your money already. And there are situations where it may be advantageous to do that. So let's say you've gone 12 weeks, you've been able to hold on to all of your employees and pay them the same amounts, but you know, you may see that you're on the horizon, you're going to have some layoffs. Well, you might want to cut off that FTE calculation, and so you want to get your application in a little bit earlier. Let's go to the next slide. As I mentioned, documentation is going to be very important. You are required to submit documentation with your applications, things like your payroll records, your payroll tax returns, your unemployment tax returns. You're going to want invoices, canceled checks for any expense you want to count. Our best practices recommendation is do this, start compiling your file as you're going along, as you're making these payments. It'll be easier to pull together. And then this last point on the written documentation of your certification of need. As I mentioned at the beginning, your loan application may be looked at as well. So let's go to the next slide. So one of the things you had to certify when you submitted your loan application for the PPP was the current economic uncertainty makes this loan request necessary to support the ongoing operations of the applicant. So this means that you really needed the loan. As all of you have probably heard, the LA Lakers had a little bit of a problem with this, or Shake Shack, or you know, some of the other big public companies. People were saying, did you really have an economic need to take out this loan? And that really came out before there was an extension of the Paycheck Protection Program funding. So people were concerned that big companies were taking money away from smaller companies. The Treasury then came out and said, you know what, we're going to audit everybody who has a loan over $2 million. And if your loan is over $2 million, you're going to have to prove to us that you had a need for this money based on this certification. So if you've got a loan for over $2 million, you're going to want to have documentation. You're going to want to be able to prove this, financial projections, stories about what's going on in your industry, things like that. On the other side of the spectrum, they said if you've got less than $2 million, we're going to deem you to have met this certification that you had a need, but you're still subject to audit. Basically, everybody's application is going to get looked at by the SBA. They may not go in and audit it, but part of the review process is that every loan's going to get reviewed. Interestingly, there was an article in the Wall Street Journal this morning about a delivery service. Some of you may have seen it. The headline was, "Delivery firm got PPP loan even as demand rose during the pandemic." So needless to say, circumstances change. And frequently people are looking at things with the benefit of hindsight. So maybe this company was really facing hard times. Actually, the story said they were facing bankruptcy before COVID-19 hit. But then, their business happened to get better because there were a lot more deliveries going on. The point is, and same thing goes with the Lakers, and actually the thing that comes to mind for me is Potbelly, which was also pressured to give back their PPP money back. This can be used to sort of put pressure on people to do things. I don't know if you saw, but Potbelly, after they gave their PPP money back, announced they were going to have to close 100 stores. So maybe they really did need the money. The SBA also recently announced, this was a change that came in over the weekend, that they will be releasing data about all borrowers with loans of more than $150,000. And that will include names, business addresses, types of business. They're not going to say how much you got, but they will talk about ranges. And Congress is pushing for more disclosure. So the certification is going to be important, not to sort of, it's nothing to be afraid of. It's just something to make sure that, you've got good documentation. You're talking with people who can help you back that up. So with that, I will conclude my presentation on loan forgiveness. And I guess, Isabel, if we have time for a couple of questions.
Yes, thank you so much, Adam. And I'll stay with you. So you've already discussed a little bit about the PPP, because we have questions about whether any of the funds are actually taxable. So I think you already talked about the PPP, but what about the other monies, the SBA, the EIDL? How does that work from a tax standpoint? And the question also I added that if you are at your end, if your year end is the end of June 2020, is it reported as revenue or as a liability until it is approved?
So let's break these two things apart. First of all, EIDL and the Main Street Lending Program, those are loans. They're not getting forgiven, as Jeff mentioned. So there's nothing to report. There's no tax ramifications to those other than you'll have interest that you're paying that's going to be deductible as a business expense. With respect to the PPP, as I mentioned on that first slide, it's sort of, Congress gives with one hand where they say the amount forgiven is not going to be taxable income. The IRS, on the other hand, takes it away by saying your expenses are not deductible, so it's a wash. So is it taxable? No, but you're not really any better off. We'll see if Congress changes that. There was some talk after the IRS announcement that might change, but that didn't go anywhere. That may still change. And then the second thing on this question about a June 30 year end and reporting as revenue and liability, unfortunately, I'm not a CPA. I think that's more of a financial statement question. I don't know if any of the other panelists have any thought on that, but it's really not a tax issue.
Thank you. Then I know we've gone over, but if you would like to stay on the line, we're going to keep answering some of the questions that we have received. If not, please feel free to exit the presentation. Another question we...
Hello?
Cindy, do you want to add something? All right, I'll just jump into the next question. We were supposed to bring back employees full-time and use our initial 8 weeks of forgiven employee payroll so that we could stop unemployment. However, now it's extended to 24 weeks. The problem is that we're still not as busy with patients due to people being scared to come in, and we have not seen our schedules as busy as we would like to. Should I still pay them at full-time wages for the 8 weeks? And after that, I am not obligated to pay them full-time work if I don't need them for their maximum hours? Ryan, do you want to take this?
Well, I think this is a PPP question, so I'm gonna. I mean, I think I can answer it, but I think Jeff and Adam would be better suited.
Well, Ryan, why don't you take just that question about going back and the extra $600, and then I could probably spend an hour talking about the rest of it. But
sure, the
Yeah.
$600 issue, and I'll just. I think there was a question, Isabel, correct me if I'm wrong, is whether or not that an individual may have to pay back the $600 CARES Act payment.
Yes.
But it really doesn't give the circumstances under which they would have to pay it back. But I would say no. There's really, unless there was some sort of fraud, and typically what happens under most states, and I've had the the great honor of practicing employment law in most states in relation to unemployment. But what typically happens is if somebody doesn't basically they're given unemployment, and then down the road for some reason it's decided they shouldn't have been given unemployment. What happens is the state typically doesn't go back and try to get the money or collect that money from that individual. But what they try to do is the next time that individual has an unemployment claim, then they just won't be able to get unemployment. So there's no provision in the CARES Act which would allow the government to go back and take that $600 back from an individual whom received it that I'm aware of.
Thank you, Ryan.
And then I'll pick up on the PPP issues. As I said, I could probably take each one of these and talk about this whole question for about an hour because it really hits on all the nuances. I think there's probably something in here from almost every slide that I had. And all I'll really say is we're generally recommending to people that they use the 24-week period rather than the 8-week period as part of their planning. But there are elements here of all sorts of all of the different elements here. The wage reductions, the FTE reductions, it all ties into the timing of when you bring people back and when they were laid off. Also, I mean, if you've had people who've left and are refusing to come back, there are some issues there that now you can get some relief from. But all of this really gets back to the idea that you really need to be doing modeling and looking at all of this. I can't really answer it in the abstract. You have to look at the exact numbers for every employee on the issues. And there's sort of this waterfall that you have to look at. You want to maximize your covered expenses, and the 24 weeks allows you to do that. Then if you've had wage reductions, I mean, you could end up with a double whammy on that, because if you had a wage reduction, you could get a $1 reduction, which reduces the amount that's available to be forgiven, and then that amount gets compounded if you've had a reduction in full-time employees, because that's a proportionate reduction. And then you've got to worry about this 60-40 cap. So as I said, this really is the sort of question that involves a lot of modeling, and something that you're going to really need to sort of work through each issue piece by piece in order to really come with a good answer. Sorry to sort of be general about that, but that's really the only way to approach these sorts of things.
One thing, Isabel, just to chime in there, because Adam brought up a good point, and one of the issues that's kind of come up with the PPP loan and also kind of unemployment in general is that individual whom, basically just doesn't want to come back to work. And one great way to document the fact that the individual didn't want to come back to work is by fighting their unemployment. So I think that's a necessary thing to do. Even if you lose, at least then you have the documentation. You can show the SBA that you fought it, and you're documenting your reasons as to why that individual shouldn't get unemployment. And I think it does. It also gives the support that will be necessary to show the SBA that, this individual shouldn't be counted for the purposes of the PPP.
It's actually required in the PPP forgiveness application. You have to submit a written invitation to come back to work. It has to have been rejected. And then you have to report this person to the state unemployment authorities. It's very clear in the rules. You have to sort of follow through all of those steps if you want to not count that person as as part of your FTE reduction.
Great. Thanks for clarifying this, Adam and Ryan. Here's the next question. I have a PPP loan and I have not spent it all yet. My new deadline is October 24. I have not worked since March 20. I and my employee were on unemployment until my PPP loan came in on May 7. I have been paying us through the loan since then. I have been ill with COVID-19 since April. I don't know when I will be able to work again. Can I put us back on unemployment for a while so that I can save the PPP loan funds for when I am back at work but not receiving payments from patient claims yet? Any advice would be helpful. I know that's a lot, but can you try to address this?
Sure. First of all, the most important piece of advice obviously is take care of your health and get yourself over COVID-19. That's the most important thing. The other thing is this looks like a situation where we've got an owner and one employee, so at least it's a little bit of a simpler situation. But we've also got, people working in the business, then going on unemployment and maybe coming back. So there are going to be some difficult questions there about how the FTE calculations work. So again, we're going to need to be very specific about how that works. But also, if COVID is keeping you from coming back, that may be a factor that's going to allow you to sort of not have to worry about those FTE calculations. Again, it's something that's going to require some modeling, but hopefully it'll be a little bit simpler. And then I guess, Ryan, maybe you want to talk about going on and going off and coming back on unemployment.
Yeah, and just I guess the simple answer there is under most, and it would depend upon state law, of course, in which state you're in, but most states now have exceptions built in for COVID-19, and both of the absences that were mentioned in that question would qualify, and you would be eligible for unemployment. So, notwithstanding the PPP loan, you don't have work available. You'd lay each of you off, and if you're eligible for unemployment, you should receive it, and that should not be an issue. So it's really kind of more the PPP thing kind of driving the bus on that question, but you would be able to do so under most states' unemployment law that I've looked at. Of course, you want to, ask counsel in your state, but more likely than not, I would say that shouldn't be an issue with the unemployment.
Thank you, Ryan. I have a next question, and I'll take that one. Can I decrease the salary of foreign nationals that I am employing? And the answer to that depends on the type of visa that they are under. And if it is an H-1B visa, you cannot decrease their salary in any manner beyond the base salary that you have stated in the H-1B petition. You also cannot bench them without work. And if you lay them off, you have certain requirements you have to adhere to, and they are not eligible for unemployment. So it's fact-specific situation. Each visa is different. If they are on an employment authorization document, you can do what you want, pretty much, unless you have a contract, and then that defaults to the contract requirements. So that's this one. We had a general question also about whether there are some guidelines and handbooks that can be used to help guide ourselves when employees need to be quarantined, et cetera, et cetera. I think, Ryan, you covered a lot of that in your section. There are a lot of resources out there online, and there's not one repository.
Yeah, and just to further answer that question, I would really kind of try to pare it down to OSHA materials, CDC materials, and Department of Health materials, or if you have materials from, an association that you trust that's industry specific. I mean, I would say that's good, but there's our law firm that you're working with, but there's a lot out there, right? So it could become overwhelming, but you know, I found that those sources have been all that's really necessary to really provide good guidance.
Yeah, and the American Osteopathic Association has some of these resources on its website as well. And then the last question of the night that I have is, how long are employers to hold a position open for an employee who can't come to work, or liability if the employee becomes infected with COVID-19 at work?
So can you how long does the employee
how long does the employer have to how long does the employer have to hold the position open for an employee who can't come to work?
Okay. So, I mean, in the question, it would depend, you know, as far as there's if the FFCRA actually applies, it would depend upon how many employees they have. But I have not. I mean, I would be very liberal with providing leave in that situation. The worst thing that you could do is terminate somebody with COVID-19 at this point, and then you know, they file an action against you for wrongful termination. And it depends upon what state you're in, whether or not it's considered a disability. Potentially, it could be a serious health condition under the FMLA if you have over 50 employees. So be very careful. I would the kind of, I'm not really answering the question, but because there's no, you know, red line time period. But if it is considered to be a disability, then at that point you would have the obligation to provide unpaid leave, and you know, until it became either an undue burden, depending upon the size of the company, which is a very difficult analysis to go through. It's very fact specific. FMLA is 12 weeks of leave. So if you're over 50, it would have to be definitely at least 12 weeks that you would have to provide that person unpaid. And then, you know, if a person was sick and they didn't have PTO, you'd probably want to compare that to other individuals whom you've given time off and how much time off you've given them. And you wouldn't want to treat the person who has COVID-19. My assumption would be that if somebody can't come back to work within, you know, 30 days, 60 days, that they're probably going to be determined by the EEOC or the comparable state agency to be disabled. And then you would have to engage in the interactive process and determine, basically, you'd have to get to the point where they're asking for indefinite leave, which usually takes several back and forth with their medical provider. So, I mean, typically you could do that in as short of time as, say, 3 months and maybe even up to a year. So that's a long answer, but it was kind of very open-ended question. So it's very difficult to give you a specific answer.
Thank you for covering these various scenarios. So we've come to the end of the questions that were submitted through the portal. Thank you for participating tonight. I'll turn it over to Cindy.
All right. Thank you all for wonderful information. Truly appreciate it. Wanted to just go through some of the resources that the AOA has. This physician support line actually was created by deal with any of the stress that you may be going through. It is free, so please take advantage of it if you feel you need the help. Also, the AOA's website, COVID-19, we update that regularly with everything that we can, and they mentioned on the webinar, I mean, things change rapidly with this. So we're trying to keep everything in one place for you to make it easier for you to find the resources you need. Some of our on-demand webinars that we've have available to you, if you have not seen them, these are just a sampling. There are probably about 15 of them that we've done since COVID started. So please take a look at those on the AOA online learning website. Those are available for CME. Some of our upcoming webinars are advanced well-being during and after a pandemic, reopening your medical practice. That one, I believe we just set the date now. It's going to be July 22nd. And that one actually will have some of the policies that were asked about for a handbook. So she will be covering policies on that webinar. We also have protect patients and staff from COVID-19 stress-induced violence that is being caused in this craziness that we're dealing with. The date for that one has not been set yet, most likely in August. And then cybersecurity and HIPAA security operating. That also is up and coming. So those will be available, so just keep your eyes open. To obtain CME credit for this webinar, you're going to go back to the AOA online learning platform. And if you have not registered, the screen that you see over on the right there, that is what you will see. You put in your AOA number and your password, and it'll take you in take the post evaluation. If you are not an AOA member, you can create an account here to get the CME credit. Question and answers, you always can reach out to the Physician Services Department. This is our direct phone number, as well as our email address. Previously, we had the emails and contact information for our McDonald panelists, and we are pleased that you all joined us this evening for this wealth of information, and thank you all for our speakers. Great job, and this concludes our webinar. Thank you all.
Thank you, Cindy. Au revoir.
Thanks, Cindy. Thanks, everybody.
Thank you.